Welcome, everybody, to Superhuman with Dr. V and Jason Phelps. I am Dr. V, and with me always is Jason Phelps. What's going on? So we have a really cool show on today, and it's something that's affecting a lot of people. We have, as our guest today, Dr. Sadaf Javaid. Dr. Javaid is a board-certified adult and child psychiatrist with extensive hands-on training and experience. She has worked in various healthcare facilities, from academic institutions to community health centers. She's treated patients from diverse cultures and backgrounds. Her training, took her from Nassau University Medical Center at Long Island, and she specialized in child and adolescent psychiatry from the University of Texas Southwestern Austin. She joined the David Raines Community Health Center in Bossier and Shreveport, Louisiana, and as a full-time consultant. And in addition to her private practice, which is called cognitive psychiatry, she also works part-time at DePelchin Children's Center in Houston. So are you with us, Dr. Javaid?
Yes, I'm here.
Hey,
Thank you so much for the wonderful introduction.
Awesome. Good to have you. I'm really looking forward to this because in my practice, I want to see, your take on it, because in my practice, I have seen, because, the COVID era that we're in, a lot of uptick in depression, anxiety, PTSD, a lot of the things that you take care of in your office. I see, like, on your website, panic disorder. I've seen an exacerbation in people, especially that were previously well under control.
Yes.
Now, obviously, they feel very, very out of control. So I really want to pick your brain today as far as, kind of what y'all do there, who y'all treat, and kind of what's your take on a lot you've been seeing lately in your practice as far as, mental health.
Right. And, I just want to start off by thanking you guys. I feel like mental health has been a very ignored specialty of medicine. I've been in the United States since 2006, off and on, even before that. And I'm originally from Pakistan. And, back home, mental health was not, it's considered a taboo, right?
Mm-hmm.
You're supposed to be strong. You're supposed to be able to take on yourself so much, and nobody really talks about it. But I did not realize, after training here and seeing a whole variety of patients from all different parts of the world, that it's still a little difficult for a lot of people to talk about it,
Mm-hmm.
to admit that they might be suffering. A lot of times we even in our daily day-to-day living, we just keep on going. So I feel like this pandemic has, it put a standstill to so many things. And our lives were just abruptly shut down.
Mm-hmm.
Right. And it made even people who maybe didn't have anything, be a little bit more attuned to their feelings.
Mm-hmm.
And I'm actually a little happy about it, because I feel like people are talking more about how important mental health is, like
Mm-hmm.
you said, right? It is such an important aspect in every stage of our life.
Yeah.
And that's why I went in child, because I felt like if I could just make one difference in one child's life, I think my deed is done.
Yep. It's still, like you said, it's very stigmatized. There's a stigma attached with it, and there's something wrong. And a lot of times it's something very easily that can be treated very, very easily. And again, what better way to do it than with children, because they're still very neuroplastic. Their neuroplasticity is still, and their learning behaviors, they're still very plastic. So
exactly, absolutely. And but we will not understand mental health until and unless we have that ability to recognize, right?
Exactly.
And we will not recognize until unless we talk about it openly. This is how I talk to all my patients. Any patient who comes through the door, first of all, I thank them because I tell them that it's not easy to sit in front of a stranger and talk about things that are so personal to you. And whether it is a CEO of a company or whether it is a 911 dispatcher, there are people from all walks of life who are coming through my doors, and I thank them for taking action and taking charge of your mental health, because I feel like they're everything is tied together right now with the way the world is. I mean, when we grew up, there was no pandemics, there was no, frequent hurricanes and all kinds of other stuff that's been going. We had a pretty simple, easy life, I think so.
Mm-hmm.
Would you agree?
So, Doc, I have a question. What kind of PTS are you seeing during this time? Is it different than what you were seeing, 4 months ago, or is it something that's evolved into something new?
Right. So that's an excellent question. And, I kind of want to tell you the kind of patients that I've been seeing in this COVID era, I call.
Mm-hmm.
So the first category of patients are the ones who have pre-existing anxiety and depression and PTSD, who are coming with, exacerbations of those existing symptoms,
Mm-hmm.
right? And then the second kind of patients are, professionals, healthcare workers. Like I said, I have a patient who is a 911 dispatcher, and you talk about PTSD. Now, being a 911 dispatcher in itself is such a it's such an emotional job. It's it really drains you emotionally. And this particular patient was able to do it. She's been doing it for 20 years, and now she first time. Imagine being a 911 dispatcher for 20 years, and you were pretty much in control of your health. You thought you were doing okay, and with this, the kind of calls that she's been taking, it's just taken a toll on her. And now every time the phone rings, she just like you mentioned PTSD. So she saw one of the patients. She took a call of one of the patients who couldn't breathe. So that is stuck in her head, and she's having nightmares. She can't sleep herself. So I recommended her to take some time off from work. So that is the extent of trauma that patients from different parts of or different walks of life are experiencing during this entire past couple of months, which have been we've all experiencing. Then the third category of people are the people who have OCD, right? OCD is the obsessive compulsive disorder, like phobias to germs, phobias to cleanliness. Now, with everybody talking about hand sanitizers, washing your hands, making sure you wipe up the groceries, initially when the whole COVID thing happened, nobody knew, right? So we were kind of, I'm guilty as well. We were all kind of blindly following whatever we would hear. So her OCD is severely exacerbated. She's washing her hands, God knows how many times a day. So that's that category. And then children. I specialized to see children, so I'm seeing behavioral issues in children who were actually doing very well, never had to see a psychiatrist, but now because of the inability to interact with their friends, being stuck at home, their parents' anxiety are rubbing on them, and then they are the ones who are acting out and having these behavioral disorders. And then the last category, I would say, children with special needs. I have a lot of autistic patients in my schedule, and they don't have the the therapies or the respite, and the people who would come to their house for all different kinds of interventions, they are not doing that anymore. So they are regressing. So it's just a whole collection of different pathologies that I've been seeing.
Okay.
Now, glad you started mentioning, and that was leading me in my second question. My second question is what has been the specific impact on the mental health of children and kids? What are the different things that you're seeing? What are the more important things that you're seeing? Are you seeing just disruptive behaviors? Are you seeing panic? Are you seeing anxiety or depression in these children? What's going on? Oppositional defiant disorders?
Sure, absolutely, and that's an excellent question, because I'm a mother myself. I have 3 kids, and I try to take off my psychiatrist hat when I come home, but I'm seeing it in my own children. So I'm seeing a whole different variety of issues that are coming up in patients. usually from maybe even as young as 6 or 5 all the way up to 18, right? So I'm seeing disruptive behaviors, as you have said, primarily because they can't go out. They are spending a lot of time on screens. I'm guilty of that because I don't know what else we could do to engage, right? um, the second thing is that I'm seeing a lot of anxiety in girls, especially. There is one girl in particular that I've been seeing very regularly, and she's been having anxiety about the disease itself, right? Anxiety about not being ever going to school. One patient I saw, which was very disturbing in the sense that he's this 11-year-old boy who wants to die. And I saw him last week and I was like, why do you want to die? And he's like, because I just want my life to be back to normal. So it's, we as adults, we struggle with our own emotions, but, we have stuff to do. We have work to do. We are trying to manage a lot of fronts, but children's life is,
very simple.
It's really shrunk, right? They don't have school, they don't have those play dates. It's summer, they can't go out to, like the way a lot of children they don't want to wear masks, because they feel claustrophobic. So
one of the things that I've seen, and I've really tried to stress, because I've seen this in clinic also, and more so because I don't see children, but I see a lot, they come in with their parents. And one of the things that I really, really, really try to stress is there a pandemic? Absolutely. Is there a COVID? Yes. But we need to stress the positives of it, including the recovery rate. I don't think enough people talk about that. To alleviate some of the, really stress to them, hey, the recovery rate is 99.9%. I think the case fatality rate is now down to like 0.02 or 0.03. And eventually it's probably going to be a lot. And you don't hear that. You hear the doom and gloom on sensationalism of the media, and nobody's talking about the positives.
And I'll tell you something, that you bring up such an interesting point, because I tell my patients, and even my own children and myself sometimes, right? Because social media, Facebook, I'm a member of all these groups. I'm a member of this COVID-19 group that I actually took a break from. I'm like, I need a break from it now. You're because we are looking for the negatives in the news. We are not looking we won't look at the 109-year-old who survived, right? But we will look at the 20-year-old who died in 2 days, right? So again, those are the things which are in our control, right? What we choose to keep in our mind and what we choose to let go. And that is what I'm trying to teach my patients all across the board, that even though this virus may not be in our control, but our reactions, our emotions, the recognition, and the way we want to, our brains are very strong, like we talk about CBT, right? Cognitive behavioral therapy, which is, we can identify the illogical thoughts that are coming in our mind, and we can try to replace them with something more positive. Right.
Well,
so
there's any number of studies, and that's the thing is, if there's only doom and gloom and they only have a negative outlook, I can point anybody to any number of studies, and I'm sure you've read them too, where positive outlook actually can affect your immune system.
You bet.
Absolutely. Meditation, things like that. There's different things that actually affect your immune system and how resilient you are, rather than it's like almost self-fulfilling prophecy that we talk about. It's like, hey, if you feel like you're going to experience this, if you can actually psychosomatically,
you can make it happen.
You can make it happen. Yeah. Believe it or not.
Yeah. I read a book about this guy who was in isolation, like he was in prison for God knows how many years by himself, and how he survived, and he came out and do a PhD. I don't remember the name of the book, only because he was focused on the little positivity that he could muster up in living in that 4x4 cell or whatever. It's very much possible. It's not it's difficult. I'm going to admit it, right? Because patients come and say, it's easy for you to say you're on the other side of the desk. I totally understand, and I tell them and I acknowledge it, but it's not impossible, right? You start off with one thing, and you, like you said, positivity. I was listening to this interview by Dalai Lama, and he said that, which kind of stuck with me. I was like, oh, this is something I can practice in my own life. He said that whenever you have a lot of anxiety, the one thing that you could do is start giving to alleviate that anxiety, and that will take your mind off of whatever you're feeling, and you're actually channeling it in a more positive direction. So we started baking cookies and distributing it in the neighborhood, and that felt good.
Yeah, absolutely. There's a lot of data on that too, as far as like we talk about it a lot, like gratitude practice. Whenever you do a daily gratitude practice, and you basically fill your day with positivity from the start, it kind of pushes out a lot of the other things. And when you have nothing but gratitude and you try to practice positivity and happiness, you have to practice it. It doesn't allow for a lot of the negative, but it's a practice.
Yeah, and with the isolation that most people kind of feel at this point, there has been no one in no study say don't go outside and don't get in the sun.
Yeah.
Right? Not one.
But that's some of the recommendations. It's like we Dr. Javaid, we talked about vitamin D, which I really, really promote in my practice, because the majority of people are very, very low in vitamin D. And any number of studies will show you, specifically with COVID, that most of the people that there was a big study in Indonesia that were basically 98% of the people that died from COVID had low vitamin D, and the same thing was echoed in Italy. But one of the things they told us from the beginning is stay inside, don't go, protect yourself and don't go outside, and it's like no.
And for all of you that gained that weight sitting inside for the last 2 months,
COVID-19.
I'm gonna tell you right now, tan fat looks better than pale fat. So get out there, get some sun on it. You feel better about yourself, I promise.
Yeah. Sorry.
Like we were coming back to the children again. We talked about what I've been seeing in my practice. The other thing I also feel like, yes, we do talk to the children. I'm talking to my patients, and we're trying to figure out strategies so that they need to make sure that they identify their feelings and they talk to their parents, right? The community go just for kids. It also means that we as adults, we need to check in with our field.
Yep. Well, and move that, so that'll go right on.
And shout at my kids.
Oh, gotcha.
They should check in with you.
Sorry, there was a lag in your feed. So now moving on to the next,
I think we got the gist of it.
Gotcha. So what's the impact now that you're also seeing on adults? I know personally I've seen a lot of, in the beginning it was okay. It was almost kind of like that hurricane mentality. It's like, there was not a lot of damage. So they were out, actually, it was a couple of days off, and then as it's, strung along and it's been strung out, now I'm seeing a lot of patients coming, hey, my depression is back, my anxiety is back, I'm not doing well, I'm not coping well, I lost my job. There's so many things. Now, what are you seeing as far as the impact of COVID on adults?
So, that's, again, an excellent question. I feel like adults, like you said, initially it was like the whole stockpiling mechanism, I call it, right? We are stockpiling on things, and we're kind of planning, right? So, but then, you plan for 1 week, 2 weeks, 3 weeks, and then what do we do, right? Things were changing so rapidly, not only with just the whole COVID, and then, everything else that was going on as well, right? So it was not just one thing that was impacting. Like you said, finance, a lot of my patients are on unemployment. It's really sad. And these are not these patients who were, I'm seeing patients who are executives, especially in the oil and gas sector. That has been hit really, really bad. So now they're coming back. So the initial stress of the pandemic and what to do. So we got that sorted out. Now with the rising number of cases, and now they're coming back with the thought of, oh my God, when is this ever going to end, right? Now it's not just the COVID. The COVID is not the main stressor. the main stresses that I'm seeing in adults is the financial stresses, the lack of, the isolation, because there are so many single patients who are struggling, right? Single mothers who are struggling because it's now stretched to a lot of extent, right? And then I'm seeing, I'll tell you something interesting. There is a shortage of antidepressant Lexapro. I don't know why. And I spoke to a bunch of pharmacies. So a bunch of patients who are on that particular medication, they are now regressing. Their symptoms are coming back because they can't find. So I'm now changing their medications. So, of course, it's the stress, anxiety, sleep. Sleep is something which I'm seeing so much. I don't know about you, but a lot of my patients are complaining about nightmares.
Or a couple of them waking up every night at 3. They say, I don't know what it is. Every night at 3 o'clock, I'm waking up. I heard this yesterday about 2 or 3 times. But the big thing, and I said this right in the beginning to my wife in March, I said, the big thing that's driving a lot of the anxiety is the not knowing.
Yes.
We don't know. Like in the beginning, it was, is it going to be a month? Is it going to be 6 weeks? Is it going to be 8 weeks? Like we didn't know, and there was no end to it.
Not only the time frame, but also the severity of it.
The severity, yeah.
Yeah, how bad is this going to be? Or is 1 out of 10 of us going to die from this? Because that was the initial
That was the
thought.
initial,
And that's terrifying. That's a huge number,
It's
right?
terrifying. But let me tell you one thing. I feel like, I think not all of us will have COVID, but all of us will have some or the other mental health impact, right? That is something that we should all be prepared for, right? They say that the next pandemic is going to be in mental health, right? So I feel like, even though if you are doing okay, daily check-ins with yourself, and then just we all want to make sure that we are prepared, right? With our coping skills and not focusing on the result, but focusing on the process. Okay, this is what it is right now. I can't control COVID, right? I can't, right? But I can control how I choose to live in this situation.
Well, so we got a short break, Dr. Javaid, from our sponsors, and we will be back in about 2 minutes. I want to ask you a couple more questions on kind of where we start, what does the process, look like with you, and then kind of, certain tips and stuff. So we'll be back in about 2 minutes, okay?
Awesome, thank you.
Hello, my name is Dr. Sadaf Javaid. I'm a child and adolescent psychiatrist, and I see adults also. I've been practicing in the greater Houston area for the past 5 years, and my practice is in the west side of town. In these unprecedented times, it is so important to check in with your mental health. Please pick up the phone and call 832-304-7244 or mycognitivepsychiatry.com, and we would be happy to help. Thank you.
This was a proud sponsor of KNLY.
Turn on your glam
91.1
today.
FM.
The Jenna Klein collection is here, elaborated with natural products. Give yourself a compliment with our organic lip glosses in more than 15 shades. With the Jenna Klein lip gloss collection, you can hydrate your lips and keep that glamorous look that you need. Turn on your glam. Visit jennaklein.com. And don't forget our skincare collection with natural ingredients that will improve the skin's appearance and prevent visible signs of aging. We have everything you need to achieve smooth and vitalized skin. jennaklein.com. Turn on your glam today.
This was a proud sponsor of KNLY 91.1 FM.
It started as a dream. When I was a little kid, I always wanted to have my own restaurant. And it was a dream that finally we had the opportunity to build it here in the Woodlands. And I'm so happy with it.
It's a really authentic Italian food. I try to maintain the most original possible. It's very important. Every day I make my fresh pasta.
Chi mangia bene, mangia italiano. Please come and visit us.
This was a proud sponsor of KNLY 91.1 FM.
And we're back with Dr. Javaid, and we're going to keep talking about, health, mental health, wellness in this COVID era. And I have a couple more questions for her. So basically, I'll let Jason start out because he had a great question on the break.
Yeah.
And so I'll let him start out with that.
With one of the things that you specialize in working with kids as a parent, what are some of the things that I need to look for in my kids that might be a sign that there's more going on than they're letting on, or that I'm not recognizing? What are some of the actions and things that kids generally have?
Some of the complaints
that
the patient, the parents are coming in.
Yeah, like how do I know when it's time to get them some help?
Absolutely. I think that is an excellent question. And, the one thing that I tell all my parents is open communication, check-ins, right? So, I'll tell you what I do with my kids every day. I, spend at least 10, 15 minutes individually with all three of them. And how was your day? What was the best thing that you did today? What was something that made you sad today? And then always be mindful and cognizant of their behaviors. I feel like smaller children usually present more with irritability, temper tantrums, throwing objects, and which is, if you notice that this is something which is out of the ordinary. Oh, he used to be such a happy-go-lucky kid. I wonder what's going on, right? And with, I have a preteen as well. So with slightly older kids, it'll be more like isolation.
Yes.
I feel like that is something which is, I just want to be in my room, closing the door, not coming down, and you're calling them. You're like, no, this is something which is not like them, right? And not wanting to talk and being just wanting to be by themselves. And this is usually for girls. So for boys, it's more aggression. I've noticed. I feel like they are quick to get angry. They are quick to just stomp off and walk off, and they don't want to talk about it because they're also scared of. First of all, a lot of them might not even know why they're feeling like this. But even if they do, they're scared of repercussions, right? They're like, oh, I don't know what my parents will think about me, but I'm having these not so good thoughts. I'm in a dark place. Some teenagers have come to me and they've used this word that I've been in a dark place and I've had thoughts to hurt myself. I think I will be better off dead. Right. So I feel like those would be some very important signs to look at, especially right now. Communication, talking to them. Are you okay? Are you frustrated? I'm frustrated too. Let's talk about it. And also acknowledging your own anxiety. I feel like sometimes as parents, we present ourselves as superhumans to our children, right? I think it's okay to acknowledge our own vulnerabilities and our own frustrations, and letting the kids know that we are feeling this as well, right? I miss my friends too. I wish I could go out and go shopping with my friends or go have coffee with my friends. I understand how you're feeling. Let's come up with a plan to make you feel better. What is it that I can do to make you feel better?
It's
right?
actually funny you mentioned that because we have a thing at our house, and we don't do it as much anymore, but we used to joke about it and the kids laugh about it. But we would say, how was your day? What was your high? What was your low? And they're like, Dad, they would in the beginning they would just do it, and now it's it's become funny and a joke, but it kind of they do that and they respond to that.
Into it.
Yeah, I've been really blessed to our youngest, because I have 4, and my oldest is 29, but our youngest is 12, and we've been really blessed that she, if anything, has gone the other way. She had been begging us to do homeschool. And we're like, well, we don't know because she's a social butterfly. We don't know if she would do well with homeschool or she, because it was forced, actually did very well with it, did all her work. And now like on her own exercises, she puts on YouTube and all kinds of other stuff. And so she's exercising on her own, doing her own work, has really, really coped very, very well. That's awesome. And so we feel really, 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 blessed.
That's wonderful. That's wonderful. And I also feel like for some children, homeschool was was good, right? Because especially the patients, or my patients who had severe anxiety, school anxiety, right? Middle schoolers, bullying going on in school. They don't like some of their teachers. They thrived with homeschooling, and some parents are continuing to do homeschool because they felt like, oh, we never knew that they would do so well. This is what was the issue all along. It was the school. So just being aware of their body language, being aware of them, and comparing them to their pre-COVID, I call state, and you notice that there is something different. I strongly suggest to all parents that just don't be afraid. Just make sure there is no harm in getting any kind of professional evaluation. Not everybody might need medications or anything like that, but and I'll tell you something. I just found out yesterday by a neighbor that HISD has now started a mental health hotline.
Oh, wow.
That's
Well,
awesome.
so what's really interesting is that there's we've really noticed with her was that she's getting more sleep. She's not getting up at 6 a.m. She was a lot of times grumpy, really quick to anger with her older sister, and now because she's actually sleeping. And there's a lot of data, a lot of studies behind this. California has before all this had a big initiative to actually start school times later. And they're already doing it. It's actually been a really big pilot program in Wyoming where they actually were allowing the kids to sleep in a little bit later and start school a little bit later.
Man, I could have told you that would have worked when I was 12 years old.
Yeah, absolutely.
We didn't need a big study to prove that.
No, absolutely.
Not one bit.
But we've seen lower grumpiness, aggression, just she's not moody, and she would get up, she'd have good sleep and do her work, and then she'd do her little workout, and then she can still. A lot of people have a misunderstanding of what homeschool is, and maybe in the past it was done at home and the parents do a lot of it. Now, like with this homeschool, she still goes to a center once a week, and it's taught by teachers that were kind of fed up with the system that as it is, and she still has interaction. They still do a lot of social interaction, which I think that was what was missing in the past from homeschool. Because I don't know if the thinking in the past was always the homeschooler kids were a little bit
very isolated.
And,
yes.
And now there's a lot more to for sports, social interaction, things like that for homeschooling. So it's almost like college. Like she does a lot of her schoolwork. They'll still go once or twice a week to the center, but then she does all her schoolwork at home. So it's almost like college. But
and that's wonderful, because I feel like she's doing it at her pace, right?
Exactly.
Whatever works for her, and she's learning and she's thriving, and which is all right. A lot of times, parents, we kind of follow. We are all followers, like the blind leading the blind. We just follow the pack. I feel like a good thing, as I'm an eternal optimist. The one thing that maybe something good might come out. I'm always thinking of what good is coming out of this, right? One thing is this, like you said, homeschooling, and it's okay to be different. It's okay to deviate from the norm if it works for you, and just the identification of what works for you. Because now we have time to think. Now we have become so resilient and adaptive. And I'll tell you something so funny. I've been seeing patients telepsych, right? Most of us are, right? And I've become so like we talk about adaptation and being flexible. So sometimes. A lot of times, especially for the older patients, they don't understand how to log in and everything. So I'm like, let's just talk on the phone, right? And they're like, they're so happy. They're like, can you do that, doctor? I can't see you, I can't hear you. So immediately I feel like we become quick thinkers, and we immediately solve a problem and we are okay with whatever we get. I feel like we've become a little bit more calm in that we don't freak out if it doesn't necessarily all have to be video and
being
audio.
okay with change. Yeah. Well, Doc, let me put you on hold for a second. We have a caller coming in right now.
Sure.
Carlos, are they on? All right. This is Jason. Who do we have on the phone? You there? Caller? Did we lose him?
Hold on, they're trying to put him on.
All right. This is Jason. As a caller, are you there? No.
Nope. All right.
We'll try again.
We'll try again.
Yeah.
So, moving on. So real quick, I wanted to, go over this with you, Dr. Javaid. What does the process look like? Okay, I want to come in and see you, or I have a patient I want to refer, but what would it look like to come in to see you from, start through treatment and finish?
Sure. I mean, I think that's a very, very good question, because anybody who thinks of a psychiatrist, they're
on a couch.
No, I don't need to. Why are you referring me? I'm not crazy. I see that a lot. I hear that a lot. I just want everybody to know that I'm human, as human as I can be. I don't have special antennas that I'm reading your mind. So it's very easy. You just call our number. We have a wonderful office manager, and we are very accommodating. I have given up my lunch breaks for patients if they really need to be seen. I'm under quite a bit of insurance plans. I do self-pay also. So the process is, the initial appointment is usually an hour, because that's the most important, right? That's when I decide with the patient if they need to just have therapy, or if they are okay. I am not quick to putting everybody on medications. Although I joke with my patients that it's my bread and butter, but I don't think you need medications. I don't think you need to see me anymore, right? I feel like it's very important for the patients to be given that autonomy to decide, but you need to explain to them the physiology and the psychology behind different emotions and different behaviors. Some patients don't know. Some patients ask me, doctor, why am I always angry? Why am I always crying? Why can't I go out in Walmart when there is a big crowd? I want to stay home, right? Some patients don't understand. So I feel like it is so important to get down to anybody's level. Talk to them, explain it to them that it's okay to feel this way, empathize with them, understand their feelings, and then decide, have a plan, right? And then I'm a big proponent of therapy. I think therapy is 50% of the treatment. Right. Even if I don't start anybody on medications, I always refer them for whether it is anger management, whether it is behavioral therapy in children, whether it is CBT for anxiety and depression. I feel like it is extremely important. And then I also do a basic blood panel for them, just to make sure, like you said, right, vitamin D, thyroid, because a lot of medical conditions can present as psychiatric issues as well. Right? Yeah. So
we have that.
We do have that caller back in. Let me try and get the caller back on. Hey, this is Jason. Are you there?
Yes, I am.
We got you. Awesome. Who are we talking to?
This is Cache.
Hey, it's Cash.
Hi. I should have recognized your voice, shouldn't I?
Yeah. No. I had a quick question. Yes, I'm here. Can you hear me?
Yes. Let's hear it. What you got?
You guys are doing amazing up here. But I had a quick question that I wanted to. Yeah. No. So here's a quick question I have, and I know you guys talk about it all the time. So one of the things, Doctor, I wanted to find out, how much do you focus on chemical imbalances in your patients from diet or, lack of exercise, and how that plays on the mental health? And how do you, from a child all the way up to adults, right? I think about, and Dr. D, you talk about it all the time, a lot of it is chemical imbalances, right, that people are having that are causing, and when you're in isolation, right, the exercise, the getting the diet right, getting the chemical balance back on track would have a lot of probably positive effect on mental health. So how do you determine that in your practice, and how do you find ways to help people, utilize exercise to help that versus medication?
Absolutely, and I think actually that's a very, very important question, and I'm a big proponent of exercise and sleep. Those are the two, and diet, right? Those are the three things which are tied into any kind of mental health disorder. I think that it is very important to have a very holistic approach. So in my initial evaluations, I spend a lot of time in talking to them about how much do they sleep, do they feel rested the next day. Yes, there is definitely a chemical imbalance that causes the depression or the anxiety or any other kind of mental health illness. But irrespective of the chemical imbalance, these 3 or 4 things are so important to fix, and which are easily fixable if you have the will to do it. So a part of my evaluation is spent in giving them nutritional counseling. We talk about various meditation apps that I always encourage for these patients. Then we also talk about 30 minutes of cardio every day.
Man, you sounding almost identical to
Yeah.
I love it. I'm doing it right because that's
fit in right with us. Perfect.
So I really like to exhaust a lot of the other things first before we say, hey, here's a medication. We go, and you may need one, but
let's try everything else first.
Okay, back up. What are you doing? How are you eating? Are you exercising regularly? Are you getting out in the sun? Are you, what are those? Because it doesn't matter if I do put you on Lexapro, 10 milligrams, whatever, that you're eating terrible or you're not exercising because there's a lot of, it's multifactorial. Yeah. So
and you talk about those, and then you also talk about your social, right? Like your family, your
community, faith. I mean,
how's your communication with your spouse or your best friend? You have somebody to talk to. I feel like all these things are so tied in together that I don't want to use medications as band-aids all the time, like we talked about, right? It's very easy for me to write a script for Klonopin. Patients ask it all the time. I don't. I said, I'm so sorry, I don't give Xanax, I don't give Klonopin, because until and unless there is a other conditions associated. But we don't need to give you guys crutches. We want to figure out the problem and fix it.
Well, we use 3 main ones, and I always point out to patients, I tell patients, number 1, sugar. Sugar needs to be considered a recreational drug, in my opinion. It just does. I mean, it's okay, but you need to think about it like a recreational drug, period. But sugar, caffeine, and alcohol, those are the 3 that we use to self-medicate nowadays and manage our energy, manage our moods. And it's like we take a downer to go to sleep, and we take an upper to wake up in the morning, and we take and there I always start with diet because even as recent as January this year of 2020, there was a study specifically that looked at it found dopamine, a direct link between dopamine, biological clock, and linked it to snacking and overeating and obesity. So I mean, there's a lot of links to like the reward center of the brain with eating and comfort foods. Like there's another one specifically about how we gain weight, how we look towards comfort foods in times of stress. Right. So think about like some of the most stressful situation we've ever been in this COVID era.
And you're compounding
and people are called, it's called COVID-19. We're joking. We call people are gaining the COVID-15 or the COVID-20,
yes,
and they are. I mean, there's a lot of people coming in, but again, just like you, it's so good to hear that you're, really put an emphasis on diet and exercise and things like that. So real quick, Dr. Javaid, we have one last commercial from our sponsors, and we will be right back in about 2 minutes.
Turn on your glam today. The Jenna Klein collection is here, elaborated with natural products. Give yourself a compliment with our organic lip glosses in more than 15 shades. With the Jenna Klein lip gloss collection, you can hydrate your lips and keep that glamorous look that you need. Turn on your glam. Visit jennaklein.com. And don't forget our skincare collection with natural ingredients that will improve the skin's appearance and prevent visible signs of aging. We have everything you need to achieve smooth and vitalized skin. jennaklein.com. Turn on your glam today.
This was a proud sponsor of KNLY 91.1 FM.
Hello, my name is Dr. Sadaf Javaid. I'm a child and adolescent psychiatrist and I see adults also. I've been practicing in the greater Houston area for the past 5 years and my practice is in the west side of town. In these unprecedented times, it is so important to check in with your mental health. Please pick up the phone and call 832-304-7244 or mycognitivepsychiatry.com and we would be happy to help. Thank you.
This was a proud sponsor of KNLY 91.1 FM.
It started as a dream. When I was a little kid, I always wanted to have my own restaurant. And it was a dream that finally we had the opportunity to build it here in the Woodlands. And I'm so happy with it.
It's a really authentic Italian food. I try to maintain the most original possible. It's very important. Every day I make my fresh pasta.
Chi mangia bene, mangia italiano. Please come and visit us.
This was a proud sponsor of KNLY 91.1 FM.
All right, and we're back for our final, couple minutes with Dr. Javaid. So again, I wanted to kind of continue on and ask you again, what does that look like? We were talking with you about what that looks like as far as coming in to see you, and you were talking about it. You emphasize the diet, and it's now when you said therapy, and you said you refer out. Now, do you do it there, or do you refer out for the anger management or for the depression, or how does all that work?
I have a couple of patients on my schedule that I've been seeing for some time for therapy. I love talking to my patients. I love knowing them and understanding the problem rather than just diagnosing them. I feel like that's more important. But if I can't accommodate them in my schedule, I do refer them out. I have a few therapists that have been working with me. We work together. I feel like psychiatry is all about collaboration. You're not just one person in a room talking. I feel like it's a very family-oriented approach. So I refer out I have specific therapists that I've been working with who are anger management specialists or CBT, depending on the needs. And now, since I've been here for a couple of years, I know different styles of the therapist. So I kind of match according to the personality, right? And according to the needs of the patient. So then I refer them out and we work together.
Oh, that's great.
Where do you stand as far as, and this is a question for me because I like, I'm looking forward now in speaking to you to referring you a lot of my patients as far as with the depression, anxiety, because there's some that, and while I, feel comfortable with a lot of them, there's some that are, I'm honestly
complex.
I don't know everything. And,
Sure.
and I would rather refer them to somebody that sees us all the time. Where do you stand as far as like supplements and there, because, certain supplementation, we're talking about going back to nutrition. Do you recommend other, because we kind of just touched on vitamin D, but that one's pretty well known, but do you recommend any others as far as supplementation rather than to medication?
Melatonin is one that I recommend quite often for sleep.
What's the what do you recommend milligram wise?
I usually for children, I start off with very, especially the children who have ADHD, they sleep is one issue that they always have. If they're on stimulants, they can't sleep that well. So I usually start off with my policy is start low and
start low, go slow. Man, I love it.
Perfect.
Love it.
So 1 grams, and then with adults, and as the trick to taking melatonin is don't take it every single day, because then the brain starts producing its own and then you have rebound insomnia. So you take it a couple of days, then take a couple of days break. 5 milligrams in adults, and I've gone as high as 15. Okay. So melatonin is something which I use quite often, and honestly I have not used any other supplements. I just tell them fix your diet.
Yeah. One of the big ones I see, and it's, a lot of research has shown, up to 75% of the population is deficient in, and it's the main calming mineral, magnesium. Magnesium is one that another one that I highly. Now, first off, I mean, I recommend a multivitamin, multimineral. I just do. I think our diet is severely deficient, even if you're eating a clean diet. But magnesium is one, and it's literally the original chill pill.
Like for those of us that train hard and work out hard daily, magnesium gets depleted so quickly. And if you don't want to be in pain all the time and sore all the time, magnesium is really important for that as well.
And then vitamin B12, I feel like that's also.
Yes.
Yep. B12, well, exactly, like any methylation factors like folate, B6, B12. B6 is really important for the brain. Omega-3 fatty acids. That's another one that, specifically the brain is 60%, and it's 60% fat. So it's like super no surprise that, not getting sufficient dietary fat or, it can adversely affect the brain, but we don't get enough. It's primarily DHA and EPA, and a lot of people just in our diet, we're just not getting enough omega-3s. And, that's another one. And again, it's just everybody's specific, so, but those are some of the main ones that, D3, multivitamin, multimineral, omega-3 fatty acids. Specifically, we're talking about mental. And just like you mentioned, methylation factors like folate, B6, and B12. You could go on and on to the gut-brain connection, we're just learning a lot more about that. I think in the next 5 to 10 years, we're going to know a whole lot more about the gut microbiome. But, the whole just generalized, hey, just take a probiotic. We don't know. Like Dr. Javaid, yours is going to be different from my species, is going to be different from Jason. So we don't know specifically. And I've seen in some people, probiotics kind of cause diarrhea and some other things. And so we got to be real specific. I'm a big proponent of gut health. It needs to be more, it needs to be individualized though.
Doc, I want to ask one last question before we run out of time, and it's something kind of a little off topic from COVID, but we have a lot of athletes and a lot of people that listen to us that compete pretty hard in different arenas and have kind of been separated from that because of all this. Is there going to be issues with people going back, and as we go back and as we start getting back to doing these things we used to do, do you think there's going to be an uptick in cases where people really struggle to get back to interacting with other people and really have problems being around other people again?
And that's a very good question. And yes, I feel like, because, we become so comfortable, initially we didn't want to be around, we didn't want to be alone. Now we are okay, we've accepted this and we've created our own little bubble around ourselves, right? I don't think the interaction will be hard, but I feel like there will be a little bit of hesitation. I feel like there will be a little bit of anxiety in being close and playing close again.
The drive to get back, I think, is going to be hard because I'm already seeing that. I'm seeing that in my clinic is people just saying,
we kind of give up.
I just don't want to.
Yeah.
Like, I don't want to. Once you stop, it's like very hard for them to get the motivation to
get it going again.
Restart. Yeah.
And like, my kids play squash and they have not gone inside the squash courts since March. And now my son says, I don't want to do it anymore. And I'm afraid of that because he's good. But my suggestion is, I think it should be slow. The incorporation should be slow and steady, and be aware of everybody's body language. If somebody is struggling, make sure that you let them know that, hey, help is there. Talk about it. What are you feeling? What are your concerns? Talk and communicate. And I don't think it should be just, it's all open now, there are 10 league matches. No, I think it should be very, very, and it should be steady and paced.
Okay, great. And then I one other last thing. My wife's currently reading a book called Master Your Emotions. I don't know if you're aware of it. Something that she's really hooked on, really likes it. One of the things that she talked to me about was skin-to-skin connection with your partner and things like that. And without having all of the social interaction we usually do, and even when we go back, not having handshakes anymore, not having hugs anymore in a lot of cases. That won't be me. I've already made that clear. But for some people, that skin-to-skin contact with your partner can be very important for mental health as well, right? Do you see anything? Is that she onto something there?
that is something that I do think about as well, because I'm a hugger. I hug my patients. I feel you have to have that connection, skin to skin. Oxytocin is released. That the bond
Well,
becomes strong.
look what we do in C-sections now. It's part of, I still go in and do C-sections from time to time with my surgeons that I work with, and that's a standard procedure. It's even the fathers in the recovery room, shirts off, baby on there. And now the move is to, as soon as the baby's out, baby is cleaned up, she's checked, lay her on the mother's chest right away for skin to skin, because of the overwhelming data about touch,
positive effects of that,
massage, things like that. So.
Right. And let me tell you one thing. There was a pandemic in the Spanish flu 1918. We forgot all about it, right? We will forget about this as well. I guess maybe initially in the 1 year or so till the vaccine comes out. And then I think that people have already forgotten about it. That's why there was like a big uptick of cases. But I feel like, yes, initially it could be something that would hold people back, but we'll get back to where we were. I'm very positive about it. It's going to take a little bit of time. I think we should not rush it, but we should just again focus on the process, not the result.
So now specifically, if somebody wants to come see you now, what as we close out, what specific conditions or symptoms or things should they think about coming to see you for?
So that's again a very, very good question. Anxiety, we all experience anxiety, but we all experience sadness. But if any of your emotions are interfering in your day-to-day living, interfering in your job motivation, interfering in your relationships, your friendships, your sleep, your exercise, your energy, then that's a problem, right? If you think that those are the issues that are going on and you don't feel right, you're just dragging yourself, you don't enjoy the things you used to enjoy, then obviously there is something going on that needs to be looked at. And again, same goes for children. Something is wrong, didn't behave this way, they're irritable, they're angry, they talk dark things. Absolutely, pick up the phone and call, even if it is nothing, right? Don't be scared of, I feel stupid asking this question, right? I've had the most interesting consultations, and I'm like, it's okay, it's fine, we just come and ask for help, and that's what I tell all my patients.
Well, awesome. So unfortunately, we are out of time. I could have talked to you for another hour or so.
I think you need to go talk to her.
Yeah, I know. Yeah. Well, I love that you do an hour. My initial consults are an hour. I feel like you can't get through all the barriers, through all the everything in a 15-minute office visit. You just can't, and they just don't get better. So it was great meeting you. It was great talking with you. Like I said, I look forward to referring some patients to you now.
Yeah.
And glad we met, glad we had you on, excited to have you as a sponsor of the show, and we will be in touch, and I'll leave any parting words from Mr. Jason.
Everybody is just unplug, quit watching the news.
Yep.
Enjoy your family, play some games, get outside, get some sunshine, enjoy your life.
Yep.
Enjoy it.
Enjoy it, and be safe.
Be safe. All right. Well, we'll speak again soon. We'd love to have you back on in a month or so and talk about other issues. But we are signing off for this week, and we will see you next Thursday.
Thank you so much.
Thank you.
Thank you.